Type 2 diabetes is a major health problem in the world and also increasingly in this country, in UK. Diabetes is developing in younger people and this is the more common type of diabetes. So we have got two types of diabetes, type 1 and type 2. And the type 1 was the type of diabetes was traditionally the diabetes that developed in younger age group, and that was not due to lifestyle issues. Type 2 diabetes used to develop at a later age, and the diabetes is due to lifestyle issues and was associated with being overweight, being inactive. But what we are seeing is increasingly that type of diabetes or type 2 diabetes is developing at an earlier age, even in kids in their teens, and in the early 20s we are seeing increasingly people are developing type 2 diabetes. So what are the options of management of diabetes and obesity or overweight? I think it's very important to address lifestyle issues in the management of type 2 diabetes. Do we have any evidence to suggest that that would be beneficial? Yes, we do. In one of the recent studies, it has been shown that if you are able to lose weight and if you can be careful about the diet, even you can go into remission from diabetes. So that means diabetes can be cured by lifestyle interventions. Now, some people can find it very difficult to lose weight, and one of the main things for any actions that you do, whether it's your action towards weight loss or anything, is their motivation. So some people have got very good motivation and they can do wonders by going to the gym, by taking up swimming, by taking up cycling, different types of physical activity, and lose weight and being careful about the diet. Some people may not be that successful even after all the attempts at lifestyle modification, and nowadays we have got medications which can assist people in achieving a degree of weight loss. By that I mean maybe about 5 to 10% weight loss can be achieved with some of the medications along with the lifestyle interventions. So it's very important to address lifestyle in the management of type 2 diabetes, whereas in type 1 diabetes mainly the treatment is with insulin. What about diabetes and other lifetime events like pregnancy? It's very important that diabetes is managed very well at the time of pregnancy, because if diabetes is not managed well, then that can lead to worse outcomes for both the mother and the newborn child. Diabetes needs to be really managed very tightly and very well from the very beginning of the pregnancy, because the damage to the baby can happen very early on in the early weeks of pregnancy. And that's why what we say is that plan your pregnancy. You need to get your diabetes under very good control, as well as you can get it under control, and then only go for pregnancy, because the benefits of well-managed diabetes is huge, not only to the mother but also to the newborn child. What are the implications of diabetes in other events like surgery? When people are going for any procedure, in any operations, we have got evidence to suggest that if diabetes is not managed well, then they have got worse outcomes. like their wound healing can be problem, they are at high risk of infection during the procedures, and they tend to be staying longer in the hospitals following the procedures because of the complications from diabetes. So again, for any major procedure, what we would say is that there are national target of blood glucose control, that you need to meet those targets. You need to get your blood sugar control as well as possible before you go for any elective procedures. What you really don't want is that you go for a procedure and then your surgery or the procedure is cancelled because of very high blood sugar, because high blood sugar is associated with all different kinds of risks during the procedure. So be mindful that if the blood glucose control has not been very well, and you are going for a major surgery or a procedure, it's always worth getting it under good control first, delaying it for a few months, getting it under good control first, and then to go for the major surgery or procedure.